Hi, welcome back for another episode of Skin and Beyond. I'm Dr. Christine Cabell. I'm here with one of my coworkers, physician's assistant, Megan Harris. We're here at the DermDox dermatology offices in Sugarloaf, Pennsylvania. And I would like to highlight today some of the other services that we offer besides the cosmetic and surgery services, more the general dermatology things that we treat here every day at DermDox. Here at DermDox in Sugarloaf, we have a pretty large staff. We have 2 physicians, 3 full-time physician assistants, 1 part-time physician assistant, 2 estheticians, and a nurse injector. And we're here to serve all of your needs, from birth until your older ages, and all the conditions that might affect your skin. And it sounds cliche, but your skin is the largest organ of the body, and it's what we present to the outside world. It's very important that your skin is healthy and that you're comfortable in your skin so that you feel well and present yourself well to the outside world. So what are some of the things that you see most often in the general dermatology side, the things that people need help with?
So the everyday things that we see in general dermatology include skin lesions, acne, warts, eczema, psoriasis.
So we like to assess patients and really get to know them. That's why it's so important that patients make the appointment and come in for their problems, because we like to assess their overall wellness, other medications that they're on. We really want to get to know the patients. We want to know what's worked for them in the past, what hasn't worked, the things that they found frustrating. We want to know how their skin problems are really bothering them so that we could help. So we work not only with the patients, but with their primary doctors to really make the best assessment to help them overall feel better about their skin and their overall health. So how about we talk about acne a little bit?
Acne can start affecting children as young as 8 and more commonly up to age 12. Teenage years, huge impact on their self-confidence.
How about women my age? I hear that a lot too.
Yeah, so about 30% of adult females are going to be affected by acne. It's a big problem.
Okay, so pretty much any time in your life from mid-childhood up until older years. And are there certain things that you have to assess when you're looking at the acne? Like, do you need to know what their hormones are and things like that?
Sure, so that's a big conversation, especially with my adult females. We talk a lot about hormones and how we can improve their hormone status or regulate their hormones, check their overall health status, talk about bacteria and inflammation and clogged pores and all the things that we can change to help the appearance of their acne.
That's important for the teenagers too, because the teenagers last quite a few years, so you really have to assess everything so we can get them through those years. Well, yeah.
And treat them safely.
Yeah.
Pick a routine and a treatment regimen that they're willing to stick to and that's safe for many years.
Now, what do you think about all the online things that people are buying for acne?
So we always hold our breath when we hear about the current routine and the things that they've tried. There are some really wacky TikTok trends that...
Yeah, and some things that are dangerous too. Some really, really strong medications that could really irritate the skin, right?
Oh, for sure. Really damage the skin barrier, really create a lot of inflammation, really make the acne worse in the long term, at risk for scarring.
Yep. And then when you're treating acne, say a teenager comes in with acne, is it always medicines with pills, or is it sometimes creams, or could it be a combination? Or
so you always assess the patient's confidence and see how much this affects them. If it affects them, we'll pull out the big guns and offer them everything we have to treat their acne. But so many patients and moms and dads are so nervous about the medicines that we do offer. So we have so many other alternatives. You don't have to treat your acne with medicine. You can come in for any one of our treatments that can help with the acne without exposing your children to medicine.
I agree. It's there when you need it, and we do have great medicines, but we have so much more in the armamentarium right now. Some nutritional support you can offer. Like I said, when it comes down to hormones, there are some hormonal alterations that we could do that really help with acne. We really want to treat the skin wellness, repair the skin barrier, help reduce the inflammation, and there are just so many things. So I really recommend a visit. I know it's easier sometimes to get online and try to work it out yourself, but I think in the long run, you get much better treatment and much more concise treatment and much treatment that's more tailored to you or your child. And then beyond the acne, like once you get control of the acne itself, as far as repairing the skin barrier, we have some other things that we do here too.
So I love that we work with a team. So we have a team of estheticians. We're going to make your acne better. You know, we're going to repair your skin, and then we can talk to our estheticians and talk about facials and overall skin health and how to keep the acne away once we've gotten it to go away, and you know, maybe talk about scar revision and changing the overall appearance of the leftover marks of your acne.
Exactly. And back to that, we certainly hope to see patients before they have scarring from acne, but many patients, especially in the older years, have a lot of residual scarring from the acne they had as children or as teenagers. And we do have some wonderful treatments now to really help with that acne scarring. The scars and the texture are treated with lasers oftentimes, residual pigmentation and redness with lasers, chemical peels, and like I said, just good ongoing skincare. So we could guide somebody through that entire process, get their skin better, and then maintain the skin health. So when we come back, we're going to talk about another hot topic, hair loss. Hi everybody, welcome back to Skin and Beyond. I'm Dr. Christine Cabell. I'm here with my physician's assistant, Megan Harris, and we're going to talk about another hot topic, hair loss. So I see this all the time. Yeah, I think in part we're seeing it a little more from the weight loss medications that patients are taking a little bit, but I think it's always been there, hair loss, right?
Super hot topic. Two most common causes recently, COVID. See a lot of COVID, post-COVID hair loss, and a ton of hair loss post weight loss,
right?
For sure.
Right. So, what men and women again?
For sure.
Yeah.
Yes.
Yeah. Both. I agree. We see both. And is it hopeless? You know, when people come in and they have hair loss, is it a done deal?
No, it's a really fun visit to kind of relieve the stress of the overwhelming amount of hair that women are experiencing when they wash their hair in the shower and panic
and then seeing the hairline recede a little bit,
back and back and thinner and thinner, and we get to tell them that it's going to be okay, and we have options to help them along that process.
And it's all ages too. Like, so I've seen some younger individuals, like so late teens, I've seen 20s, and then obviously up into sort of like 40s, 50s, you see a lot.
Sure.
Yeah.
Yep.
So I agree with Megan. There are so many different causes of hair loss, so that gives us a lot of opportunity to sort of investigate, find the cause, and help either reverse or slow down the hair loss. So I know, say like hormones are one thing, right?
For sure.
Hormones being off can cause hair loss, and aging as well, right?
For sure.
Right. How about some other things?
So, you know, post-infection or post-trauma, some health status kind of abnormalities. We do a range of blood work to kind of evaluate status of the things that can cause your iron stores, hormones.
Also, like you said, overall health. So some other diseases, like say somebody has, you know, an arthritis and they go on a certain medication. Maybe that medication is at play. So we're going to talk to you, again, get to know you as a patient, find out when this started, kind of do some investigating around the time that it started, different things that you're doing, maybe talk to your primary doctor. We want to get labs. And then there are some tests that we do that you really would only have done in a dermatologist's office, right, to investigate. So we're going to look at the scalp, and what other tests can we?
Yeah, so, we do a very good physical exam of the scalp and look at the hair shaft and the health of the skin of your scalp to see if there's any kind of inflammatory process that could be driving your hair loss. We can take a sample of that skin and have that tested as well.
Yeah, so really getting to the bottom of what's causing the hair loss and then what we could do to fix it or, reverse it or slow it down. And that's important too, to really give the patient a realistic assessment of how much improvement to expect, So some people we might be able to completely reverse the hair loss in some cases of alopecia areata and things like that. Some people we could get the hair to grow back slowly or slow down the hair loss. But with coming in and us getting to know you and really finding out what the problem is, we could give the best realistic expectation of how much they're going to get better from treatments. And our treatments range anywhere from topical medications that go on,
we have
oral medications.
Some options for oral treatments, clinic procedures that we offer here at DermDox.
So we offer a great procedure here at DermDox that is very promising for some patients with hair loss. Again, we would assess you and see if that's worthwhile, and that's called PRP. So what is that exactly?
So we'd actually kind of draw your blood and spin down the blood to be able to draw off the plasma portion of your blood, which is very dense and
rich in like growth factors and nutrition basically for your hair follicles, right?
For sure,
So, yeah.
to stimulate growth, to encourage those shafts that may not otherwise have been able to produce a follicle to start to stimulate new growth and start to offer relief.
So one of the things that we might do, we might have somebody on a topical, we might make sure the hormone status is correct, and then bring them in for these scalp treatments where it's all natural. So again, it's your own blood spun down, your own platelet-rich plasma, which is rich in all these growth factors, and we inject it into the areas with the hair loss. The results are pretty phenomenal. We have some before and after pictures that we'll share with you on that. So it's just one treatment. Also, nutritional support is something that we have here. There are some amazing vitamin products that stimulate hair growth as well, right?
For sure.
For all ages.
Mm-hmm. Yeah, we love our Nutrafol products. They've come out with a new line that is showing a lot of promise.
So Nutrafol has been around a long time. It's essentially a vitamin that offers nutritional support for your body overall and also specifically for hair loss. They have some amazing new formulas. They have one that's more specific for men, one that's more specific for women in perimenopause and menopause. That's fabulous. Not only helps with the hair loss support, but helps with some of the symptoms of perimenopause and menopause as well. And there's a vegan option now.
Yes, which is my favorite, the new vegan option for Nutrafol.
Eczema, atopic dermatitis, itchy rashes. So, Megan, I oftentimes think about little babies having this kind of eczema, but
eczema affects people of all ages. We see it more commonly in children, but we see adults every day with eczema.
Awesome. And how about these little cute babies when their parents bring them in? They're wanting to bring them in because they want to get them better, but they are afraid of using some of the medications, I assume. Like I hear a lot about parents not wanting to use steroids and things like that, rightfully so. But is there any way to help them without those?
So for our smallest patients, it's, I feel like a lot of times I'm treating the mom and dad more than I'm treating the kiddo and telling the mom and dad, it's okay. We need to treat these children with anti-inflammatory medications when we're treating such an inflammatory condition.
Right.
So we do use the steroids and we teach them how to use it appropriately, safely. Let them know that, we're going to be with them every step of the way and make sure that we're not doing any harm to these children. We're just helping them.
So, and you're making them more comfortable. You're repairing their skin, basically, right? Working with the parents too. So that's important. It's a whole family unit. So we're going to really assess what's going on at home and working with them so they know exactly how to bathe their child and what products to use. They're not throwing their money away on all kinds of things that they don't need to, right?
For sure.
Yeah.
Teaching them what to introduce to the baby's skin and teaching them things that we need to keep away from the baby's skin.
Awesome, awesome. And is that a lifelong treatment that they're going to need, or do they typically get better? Or
the vast majority of kids are going to grow out of this. My counseling usually goes something like, every winter will be a little bit easier for these kids.
Right.
Sometimes they grow out of it, sometimes they grow into it, but we stick with you and help you
work
through
with you
every step
of the way. Exactly, a common theme. How about adults with eczema? I think a lot of patients probably think, oh, I've had this my whole life. It's just going to be like this. I'm just going to itch all winter. Is that the case?
It's definitely not the case. And so many have given up because there was just not great options to keep them under great control. But now we have these wonderful new drugs that are life-changing for so many of these adults.
Agreed. I'm sure a lot of patients see all these commercials for the different drugs with these long, fancy names. But the bottom line is there are more options available now. And there are some medications that patients can take at like an every other week or even every month basis to really improve their skin. And when you improve your skin, you improve your quality of life. So for somebody who spends a lot of their life itching, not being able to sleep because they're itching, embarrassed to wear certain clothes, or knowing there's certain things that they can't do, like swim because it's going to set off their skin, it's really life-changing. So I don't care how old you are, how young you are, and how long you've lived with it. If your skin is struggling, you should come in and talk to us and see what kind of things that we can offer to make you more comfortable. Here at DermDox Skin Solutions, we have two specials that we're running in March. The first is the Body Right package. So we have a discounted package for Body Right, which includes 5 physique sessions and 3 deep radiofrequency microneedling sessions. Those sessions are used for body contouring and skin tightening, which it's a great time to do that since summer's approaching. It's also a great add-on for patients that are doing weight loss treatments. The second is our Tetra CO2 laser, which is a resurfacing laser that tightens the skin, reduces fine lines and pigmentation of the skin. So both of those are March specials. In addition, if you call and make an appointment and want another procedure done, just mention that you saw us on SSP TV and you'll get a 10% discount. When we come back, I'm going to show you the Glimpse, which is a wonderful new tool to do a scientific assessment of your skin to help us plan for your ongoing skincare. Welcome back to Skin and Beyond. I'm Dr. Christine Cabell, and I'm here without makeup because we're going to show you our newest machine, the Glimpse. I'm here with Mikaela Tobash. Mikaela is our Skin Solutions Practice Manager. So Mikaela, what's the Glimpse?
So nice to meet everyone. So the Glimpse is our professional skin evaluator machine. It uses a couple different kinds of light to take professional photos of your face in different angles. And it helps us to assess the problem areas that you might have, such as pigmentation, redness, wrinkles, pore size, and all of that fun stuff.
So after the Glimpse is done, we can evaluate what treatments you may benefit the most from. And we can also check in after treatments, right, to see what changes have occurred. So we'll show you how this works.
So right now what it's doing is her face is in here, she's straight on, and it's taking pictures in those 4 types of different lights that we talked about. You're going to turn the other direction. And the last one. So like Dr. Cabell mentioned, it is great for designing treatment plans for our patients in the office, but it also does a really cool feature, and it is the age progression feature, which will show you what you look like in 5, 10, and 15 years. Also does something really important. It checks your moisture levels in your skin. And so this little reading here is going to see how nice and hydrated her skin is. So now we come to our fully comprehensive dashboard. Now that big circle in the middle has those red dots on it. Those red dots represent the areas of concern that we want to treat. Now the closer that those red dots are to the inside of the circle, the lightest part of the circle, the better. The machine stacks you up against other people in your age group. You put your birthday in and it actually ranks you and your concerns among the other people, among the data that they've collected with this device. So we could go to our first concern page. Our pores, something that a lot of people struggle with. There's a lot of things that we can do here at Skin Solutions that can help minimize the appearance of pores. Our wrinkles and our fine lines. So everybody gets fine lines. A lot of that is sometimes due to dehydration. Some things that we want to focus on for our wrinkles and our hidden wrinkles, which are the wrinkles that will come out eventually as we continue to age. It looks like Dr. Cabell is so lucky she is in the green on both, shows she is below average for her age group. Some treatments that we have here, like our CO2, a more aggressive treatment, or even a cool peel, which is a little bit of a lower downtime treatment, as well as medical grade skincare that you do at home, like retinol, and all the fun things like that. We move to our pigmentation. This is always the hot button for everybody because nobody wore sunscreen when they were kids. Now we can see the underlying damage on here under the UV light. So this is your melanin, right? And this is not anything new. It's damage that you've probably gotten
Years of lifeguarding.
Years of lifeguarding in your teenage years. This is what happens. And then, over time, if we're not continuing to wear sunscreen, when the sun hits that melanin under the deeper layers of your skin, it turns into dark pigmentation that we can see on the skin.
So again, for melanin pigmentation, we have medical grade skincare, we have some chemical peels that hit pigmentation, and we do have a laser that helps with that as well.
Move on to our reds and browns. Redness manifests as a result of sun damage and aging as well. Some things that we can do to treat redness would be like our Modus AZ Plus laser, fabulous for treating redness and teeny tiny little facial veins and even rosacea.
Sunscreen.
And sunscreen. And always sunscreen. Yeah. Move on to our sebum results. So this is a really interesting portion of the glimpse. It can actually tell us what skin type our skin is. And it helps the providers, ourselves, and patients to really understand what they can be doing both in office and at home. Oil and sebum and acne-causing bacteria is something that a lot of people struggle with, so making sure that they're using the right regimen is important. And then we have our skin tone. This is your overall kind of complexion, how even your skin is, and a lot of different things can affect this, such as the pigmentation that's on your skin. So the more pigmentation you have, the more uneven your skin tone is.
And even if somebody gets a laser treatment for pigmentation, they still need to do ongoing skincare for that, right?
Absolutely. Skin is not a one-time kind of deal.
Yeah, I agree.
We have to make sure we're taking care of it. Our radiance, which is how well our skin reflects light. We want to be as radiant and glowing as we possibly can. So some things that could help that are some more hydration. Our complete dashboard is here, and we, give patients a little report card that they can take home with some of our recommendations.
Even I need a reminder of what to do,
Absolutely.
Day by day.
Absolutely. It's not always easy.
Thank you.
Absolutely.
So I will mention that the glimpse is actually done free of charge at our office with any consultation, or even when you come in for any of your treatments. It's something you could just call and ask for an appointment for. We're happy to do that for you as part of your ongoing skincare. Thank you again for joining us at Skin and Beyond. We're here at DermDox in Sugarloaf, Pennsylvania. Thank you, Mikaela.